Brains in Motion with Mary McKone, Ed.D and Angela Zielinski, DPT. Please remember that this podcast is for entertainment purposes only. This is not medical advice, and this is just general discussion for educational purposes. A note for this podcast, we are still learning how to use our software when we have guests. So we thank you for your support and kindness as we share this fun conversation with Dr. Judy Belk. Thank you. Enjoy. Welcome back, everyone. Hi, Mary.
Hi, Angela. Great to see you again.
I'm so excited. Today we have a guest. We have one of Mary's, friends, coworkers, longtime colleagues?
All of the above with 2 pluses after that, yes.
We have the wonderful Dr. Judy Belk. She has the office for Center for Communication and Learning Skills in the Portland metro area. She is a longtime dually licensed audiologist and speech-language pathologist, also with a developmental psychology background. In her practice, she evaluates people for auditory processing disorder, and she also, what's super great about Dr. Judy is she includes other specialists to address other concerns such as visual processing and foundational therapies such as reflex integration. That's us, right, Mary?
That is us.
Yes. Dr. Judy, thank you. Welcome.
Thank you. This is a privilege to be able to hang out with you two brilliant people.
Oh, thanks.
You are so kind.
Kindred spirits.
Mm-hmm.
Yes, kindred spirits. I'm so excited that you're here for this auditory processing discussion. May I ask how you have all of these credentials and you're both a speech language pathologist and an audiologist.
Mm-hmm.
How did you find this path in auditory and working with people with auditory processing disorder?
Well, I was one of those kids who knew early in life, like when I was a young teenager, what I wanted to be when I grew up. And I thought it was just a speech pathologist because I thought that's all you could be. You know, you just major in that because what else would there be? But then I had so many questions. And then I happened to choose the right university to go to, Syracuse University, to work with a specific, very eccentric professor, Dr. Lou DiCarlo, and realized you could be both. And it made so much sense that what the ears bring in, the mouth can reproduce.
Yes.
Go together. They have
Yes.
to go together because we're always self-monitoring. Then with some more questions that I had about how and why kids talk and listen, not just hear, and there's a difference between hearing and listening, and what do we need to know about how you turn on listening? Because it doesn't seem to be automatic, that tuning in and leaning in and being fully present. How does that work?
And Judy's been practicing quite a while. I will not give away her age, but she's been in the field a very, very long time, and she has worked with many remarkable people. And although she's one of the most humble people I've ever met, she is a giant in this field. So we are very blessed to have her in our presence and on our podcast. I just happened to be lucky enough to meet her when I moved to Oregon. We had a student at the school where I worked that was a client of hers, and that is how we met. And we have been tight friends ever since. So I'm very blessed that she was brought into my life.
Well, we both realized at that meeting, Mary, that we had the same idea about how to work as a team on behalf of our kids.
Yes.
That the input from other professionals was critical.
Yeah.
Absolutely critical.
Yeah. And one of the things that came out of that, and then we'll jump right into auditory processing, I promise, is that Dr. Judy and another friend of ours started this collaborative group for professionals in our local area, and now we call it the Integrative Care Collaborative. and she invited me to participate. And at the beginning, it was like 4 of us sitting around her kitchen table. And I think at our high point, we had about 25 members. But these are all local practitioners. So audiology, speech pathology, OT, PT, naturopathy, functional neurologist. Me, I was the educational representative and also reflex integration.
Neurooptometrists.
Oh, neurooptometry. Yeah. So we had such a broad range of practitioners, but what we had in common is we all worked with kids with developmental needs. And the conversations that came out of those discussions really helped us begin to understand how interconnected all of our work is, and helped us understand each other's language and perspectives. And it enabled us to do much better, deeper, and faster work, and learn how to prioritize what child should see who when and in what order, in order to expedite their treatment plan. It was just a remarkable experience. And I'd really encourage people out there, if you're practitioners, to try and do something like that, because it's made such a difference in our lives professionally. And it also gives you a network of people that you know you can trust and have a similar ideology to work with. So with that, we should probably jump into our real conversation today, which is auditory processing disorder, and then, of course, how reflexes are involved in that. So, Judy, can I get you started?
If you can think about what your ears do, you're looking at the external part, the auditory system, and beyond the outer ears, inside, is the middle ear. And that's a really important part of this whole system, because a lot of kids have ear infections. That becomes really important information when we're talking about whatever that auditory processing thing is. You need to know how the middle ear is functioning. From the middle ear, sound goes to the inner ear. That's where the cochlea is, which is a snail-shaped organ. And beyond the cochlea, that's where auditory processing begins. Begins at the brainstem. And so if you touch your neck and touch behind your head, you're going to be in the area of the brainstem, and then sound comes up to the cortex on each side. So if you think about where your glasses are, if you wear glasses, going along the side of your head, so that's about where the temporal portion of the cortex is. We're talking about not just hearing when we're talking about auditory processing. And the easiest way to think about it is listening, the tuning in and being fully present, and what's involved in that. Okay? So auditory processing disorder is when that system doesn't work well. And what people typically will tell us is, I can hear you talking, I can hear your words, but I don't know what you're saying. Right? It's not a language problem, right? Because we always have to tease that out. Is it a receptive language problem that you're not understanding the vocabulary, or you don't understand how sentences get put together? It's not that. It's not that.
So it's everything that happens from the cochlea to its final landing place in the temporal lobe, because it makes quite a little adventure, right? From the cochlea to the brainstem to the thalamus, and then out to the temporal lobes, right?
Right. That is one way, and a typical way that when kids are beyond infancy, that the hearing system works.
Because a lot of kids that we work with, they've gone and had their hearing checked, and their hearing's fine. And right, and then they're told, well, there's nothing wrong there. But it's not about hearing. It's about what the brain is doing with the information once it comes into the cochlea.
Right.
I think what you said about hearing versus listening is a very important concept that I would like to highlight, because there's such a difference between I can hear what's going on.
Yes.
And I've also understand that it like sometimes kids can hear too much and like not be able to filter the information.
Yeah.
So there's a difference between I am hearing the environment and I'm listening to what you're saying.
Right, because listening is an active process. The auditory system is designed so that we can tune in easily and tune out easily.
Yes.
I think that's an easy way to explain that.
Yep. So, Judy, one of the things we've talked about in the past is that auditory processing is kind of a big umbrella. And there's lots of skills that are involved in auditory processing. Like for our listeners, phonemic awareness is a subset of phonological processing. So under the bigger umbrella of auditory processing, we have phonological processing. And then part of that is phonemic awareness. So when we look at testing for dyslexia and we see poor, like on the C-top, and it will show that there's poor blending and isolation, and that is a subset of this larger topic of auditory processing.
There's a very high correlation between dyslexia and auditory processing disorder.
Yes, there is.
And it's easily seen in just what you said.
Mm-hmm. Angela, did you want to jump in there?
Will you remind us, what does phonological processing mean for people who aren't in the educational system or your guys' domain of?
Oh, sure. So from my understanding, phonological processing is kind of the larger understanding of like rhyming and being able to hear all the words in a sentence, like the dog ran away, and then the syllables in a word, doorknob, like a compound word, or bottle, which is not a compound word, and then the individual sounds, which are the phonemes. And that's how you get down to phonemic awareness, is down into that. Yeah.
That's right.
So besides phonological processing, we have things like auditory attention.
So think about this, that everything starts with awareness of sound. When you're thinking auditorily, it's the awareness, there is something. And then you're paying attention to this and trying to figure out what that is. And it all happens in a flash if it's working well.
If it's not working well?
And if it's not working well, then we have to train awareness and attention. Right?
And auditory attention is partially regulated in the prefrontal cortex as a subset of executive functioning, but tied to the auditory system. Right?
So auditory processing really relies on a number of parts of the brain. The sound doesn't just land in the temporal lobes. There's much more to it than that.
I'm trying to think of some other things that come under this umbrella. Oh, auditory working memory, being able to hold what you heard and working memory long enough to use it, right? Like in a classroom, the teacher said, take out your book, turn to page 42 and grab your worksheet. And the kid heard book and maybe pencil, and that wasn't even said because they couldn't hold it. And then they're looking around the classroom like, what did she say?
So we always look at decoding as one of the primary issues. And then we look at working memory, just as you're pointing out. That's very essential. We always then look at sequence and the organization piece of it. And some of that is related to other modalities, particularly vision. So that's where this starts to get complicated.
Oh, like visual auditory integration, how well those systems are working together?
Yes, because the tracks that are in the brain, vision and auditory, are right next to each other. In fact, it frequently happens that whichever modality becomes the primary one to work on, if there's visual processing problems and auditory processing, for example, each influences the other tract. And so let's say we start with a neuro-optometrist work with vision processing. We may see, even without starting an auditory processing routine, that auditory processing gets somewhat better.
Mm-hmm.
So interesting. It's like hands and speech. And when we talked about other topics, like with reflex integration, because overlap and the
overlap.
Right.
That's cool.
And then another big one that we find in classrooms is auditory figure ground.
Yes, auditory figure ground. Absolutely something we look at. We're always looking at understanding when there's noise in the background. Or if, for example, you're in a group and one person is talking to you, you're trying to tune out the group conversation to tune in. You have to be selective about that and be able to teach. Or sometimes you want to hear two things at the same time, and that's called dichotic. Di meaning two, right? You want to hear both. And the auditory system knows how to do that.
Cue all moms is what I think of when you say hearing two things at once.
Right? Yeah. I often explain this to my clients, given my education background, is imagine a kid sitting in a classroom. We're talking about auditory figure ground. The teacher's talking. The kid behind them is tapping a pencil. The clock is ticking. The door open. Somebody's rustling papers. And the auditory figure ground gives the child the ability to zone in on the teacher and push out the other things, which I can localize. My ears can figure out where the teacher is talking, which localization is another important skill. And then I can mute everything. Think of it as blurring your screen when you're online so people don't see, where you are. It's kind of like that. I can blur all that in the background and just pay attention to the thing that I want to. And a lot of the kids that we work with cannot do that. It's like everything's coming in at the same volume, so to speak. And I put that in air quotes. It's not really volume, but the brain doesn't have the ability to decide importance, which is an issue in really the brainstem. It's not like filtering. That reticular activating system is really involved there. It can't decide, is that important? Is that not important?
So that's a big ask of the auditory system, isn't it?
Yeah.
Think about that is huge. That we're supposed to be able to do that.
Yep.
I'm learning so much. But the part that also affects all of this is nervous system regulation.
Yes, absolutely.
If you are in a state of fight or flight or freeze, your auditory system, all of these processing systems are going to change or work differently. Is that right?
That's exactly right.
In the brainstem and the mesencephalon, there's this little area called the sensory nuclei, and right next to that is where the vagus nerve comes in through the brainstem. Yeah. So if we don't have enough development in that, in the sensory neurons, or the vagus nerve perceives there's danger, it will affect the sensory processing in that area of the brain. But before we get too deep into that, I was wondering if you could give our listeners a couple more ideas of what some signs might be that a child has auditory processing challenges.
Let me tell you some things that are on checklists that we use. One of the ideas is, does the child pay attention / listen to instructions more than 50% of the time? Or is this a person who just can't do that? Is this a person who needs to have instructions or part of conversations repeated? This is the kid or adult who says, huh, or what, or please say it again. Is this a person who struggles to listen to an auditory stimulus for more than a few seconds, which would be long stories or instructions, right? So short attention span is something important that we need to look at. Does the child appear to daydream? That attention drifts from time to time. Somebody also who is easily distracted by background noise. There was some experiences difficulty with sound discrimination. For example, being able to tell when two sounds are the same or not the same.
Like the difference between bat and bath, right?
Yes.
They can't discriminate the T from the TH. That's a
Right.
that's a subtest on a lot of
That's
these,
right.
like the taps. That's one of the tests on the taps. Yeah.
Forgets what is said in a few minutes. Difficulty recalling a sequence that has been heard. In fact, difficulty with some sequences, the days of the week, the months of the year.
Mm-hmm. I was going to say that's a subtest too, right? Like number sequencing and letter and sentence memory. Those are common subtests. Looking at auditory processing is if I give a child 3 or 4 unrelated words, could they repeat those back to me in the same order? What if I did 5 words or 6 words? And when kids have auditory processing issues, I find they can get to about 3, and then it falls apart.
That's right. Frequently misunderstands or mishears what is said, appears to be a selective listener, slow to grasp concepts for age and grade level. Poor auditory learner, might be a strong visual learner.
Mm-hmm.
Delayed language abilities, has difficulty expressing ideas verbally and or getting ideas onto paper.
Yeah. So what is one of the things that IEP teams always say about kids on the autism spectrum? Oh, they're visual learners.
Yes.
And so much so that that's become almost like legend in school systems. Oh, well, kids with ASD, they're just visual learners. No.
Why would that be?
Because in my experience, it's a 1-to-1 correlation that kids with ASD also have auditory processing deficits.
Again, a high correlation. Yeah.
Right? Obviously, there's going to be exceptions to that, but...
Do you find that true for kids with ADHD too?
Yeah.
Because I feel like all the things you described are a lot of ADHD, like the attention, the pieces. And so like, it's so interesting that the test that you're giving for, quote, I'm making little air quotes for auditory processing, is a lot of what I think of for kids with ADHD. So interesting.
Exactly.
And here's a fun thing I learned recently from Dr. Darren and some training I did with him, this Darren Barnes-Heath in the UK, is in the insular cortex, all of our sensory information and our interoceptive information all comes up together and lands in this insular cortex. And then the insular cortex says, hey, prefrontal cortex, do I need your input here? Parietal lobes, where we process sensory information. Do I need you involved? Hey, amygdala, do you need to get involved? Limbic system. But it's the sensory information, including vestibular, which activates the prefrontal cortex. So if kids are having attentional issues, we do have to look at these other pieces of that puzzle, and auditory processing is such a big one. And we've also talked about the connection between cognition and auditory processing to the broader audience, not just our kiddos. I had big issues in auditory processing after my brain injury that Dr. Judy helped treat me for afterwards. So even concussion and TBI can greatly impact our auditory processing system. And I didn't hit my temporal lobes. I hit the back of my head. So it wasn't like in the region where you would like think like, oh, well, she hit her temporal lobe, it's going to affect our auditory processing.
Absolutely true what you're describing. Okay, there's that vagus nerve.
Yes.
That has its tentacles in the face.
Mm-hmm.
It runs down. It's the longest nerve in the body. It goes down to the bottom of your stomach.
Mm-hmm.
And all of that input involves auditory processing.
And you and I have discussed polyvagal theory and auditory processing probably many times over Thai food. So that is our preferred dinner together. So for our listeners, I just wanted to kind of talk about like the different states of the vagus nerve and then like how that might So there's two branches of the vagus nerve, the ventral vagal and the dorsal vagal. And the ventral vagal branch develops is fully developed by about 33 weeks of gestation. So for
Right.
these ultra preemies that are born before 33 weeks, they don't even have a fully developed ventral vagal branch of their vagus nerve. So in Dr. Porges's teachings, the states of our nervous system are parasympathetic, which is rest and digest, sympathetic, which is fight or flight, and like the temporary freeze, like just a second, like, oh, was that safe? Yes, it is. Okay. And then dorsal vagal, which we would call fear paralysis, which is the withdrawal. How might auditory processing be impacted by somebody, which happened to me in my brain injury, right? I went into fight or flight and I stayed there for months because my brain was trying to heal. So what happens to auditory processing when we go into sympathetic?
Well, the processing stops its normal route. And so there's not that opportunity to quickly figure out what is being said, what's being heard, to analyze. That analytical portion goes to, am I safe? What's happening? You're listening for more critical information that has to do with safety.
Right.
Right.
Like I often tell people, like, it's kind of like, have you ever been so upset and somebody's trying to talk to you and you just like put up your hand and turn away? Like,
Right.
Because your ability to process language gets greatly diminished when you're in fight or flight. And then, gosh forbid, you're in fear paralysis. The brain doesn't care. Like,
That's right.
What are words? Words are stupid. I'm going to be quiet here and invisible in a corner, right?
Right. You don't have the energy or the capacity to delve into what you truly may be listening to.
The brain is making choices. What's important for me to listen to? I should probably listen for, oh, was that a cougar stepping on the branch over there that's about to eat me? As you know, what was that sound? So as I recall from my study, we become really hypersensitive to certain sounds, but we start filtering out other sounds.
So here's an example that people can relate to. I once had a child who came for the Tomatis work, as a matter of fact, Tomatis therapy. And her dad brought her, and he came in on crutches. He wanted to experience the Tomatis program at the same time, which meant also giving him the Tomatis listening test. And some things on that test, if you pick, it was done with an audiogram, and the sounds that he heard so easily are usually very difficult. So I said to him, is it possible in your life you were in a situation where you had to be really precise about what you were listening to? He said, oh yeah. He said, when I was 2, I had polio, and I had to teach myself how to listen for the nice nurses who were not going to harm me versus the other nurses who were going to give me shots or whatever.
Oh, wow.
Right. And
Wow.
so those things you can see if you interpret an audiogram in the Tomatis view, that there's more than just tones that you're listening for. But why would some people be so precise at hearing tiny sounds?
Right.
Does it go right? And does it go along with their life experience? So there are emotional components that drive auditory processing.
Yes, there are.
Right?
Yep. So you were telling me that you wanted to touch on kind of like the segue between auditory processing and reflexes.
Yes, because when you think about the learning pyramid, it's essential to realize that reflexes are the foundation for the rest of learning that can happen.
And
so
I took that pyramid and made it into a staircase, which we could attach to this podcast as a resource so people can take a look at that.
Yeah, I think it's really important to understand where auditory processing comes, and reflexes are right underneath. And we know, and you folks know in particular, which particular reflexes affect auditory processing. And that's information that not so many speech paths and audiologists know.
They do not. And I was so grateful to you for your deep interest when I demonstrated for you what reflexes could do with that student that we met that brought us together.
Yes.
That Dr. Judy actually went and took some classes from MNRI to learn more about it. Not that she practices reflex integration, but that she felt, you know what, I have to understand this.
Definitely.
So that I can see what the connection is. And it really did change the way that you practiced and perceived challenges with some of these kiddos, yeah?
Right, because now there's a whole part of my intake process where I'm asking questions that relate to behaviors where I know the reflexes are underlying those qualities.
Yeah.
Yes, it's a huge difference.
Wonderful. Wonderful. Before we go for today, I was wondering if you could talk to our listeners a little bit about how the auditory processing system matures from infancy, like because one of the things I explain to people frequently is that even though, say I'm working with a 7-year-old, that their sensory systems may still be operating at an infantile level.
Yes.
Right? So could you speak to that just a little bit? Like, how does the auditory system kind of develop from infancy? Like, what's the difference between the way an infant processes information auditorily versus an older child?
But I think this is fascinating. So for us and for babies who may be more than a year old, sound travels in a very direct route from ears up to the temporal area. For babies that are just born, sound travels in a little different way. It takes a right turn. The sound goes through the part of the auditory system where we make meaning out of what we are experiencing. And we hold on to those meanings. Like the example, actually, of the man who had polio and the sensation of sound he had to be worried about, and he held on to that.
Well, there was an emotional response, right? It was, yeah.
That's right. And so the amygdala is part of this, where babies generally eventually figure this out, that, oh, the door closing, not a problem. But they begin to relate sound and vision and touch. And as they mature, then sound becomes more automatic directly to the lobes.
Right. So in an infant, you know, they recognize the sound of mom's voice and the beating of her heart.
Right.
And that's safe. And then everything else initially elicits a startle response.
Exactly.
Because the brain is feeding that directly to the limbic system, to the amygdala, and we get a startle response, which matures past infancy. It just becomes the startle response is fight or flight. So then as the auditory system matures, it's not just getting diverted to the amygdala, because like you said, like through experience and exposure and co-regulation with mom or caregiver, like, oh, was that scary? But you're okay. So then the brain says, oh, there are more things that come in through my auditory system that are not dangerous. And the reticular activating system and the brainstem and the mesencephalon says, oh, I can let that go ahead and go up to the thalamus, and the thalamus then sends it out to the temporal lobe. So in that original pathway that babies have in the first few months of life, everything elicits a response from the vagus nerve as a startle response, right? So the implication here for kiddos with developmental issues is that many of them continue to grow physically, but their auditory system is still on this non-classical pathway where everything elicits a response because it hasn't matured We don't have enough activation in the brainstem, which is actually the issue. There isn't enough activation in the brainstem so that the RAS can allow, it's the great gatekeeper, can allow it to go further. So it just keeps getting diverted, which is why kids become so sound, or they remain very sound sensitive and overstimulated and have to wear headphones and can't handle certain frequencies, usually the higher ones, because they're still operating on this immature pathway. So, Dr. Judy, I think our time has come to an end. Did you have any closing thoughts for our listeners about auditory processing that you would like them to walk away from this podcast with?
Well, I would love for babies to have the experience with lots of music, different kinds of music, and how we rock babies and that's very thing, and dance with babies. Lots of experiences with knowing where they are in space, because that vestibular input is critical also. Lots of nursery rhymes, so kids used to rhyming.
Clapping and rhythm.
Yes, and when they can stand up themselves, dancing for sure, right? And listening to the differences between soft and loud and fast and slow and opposites that you have a sensory experience with. Yeah.
Well, that's wonderful. I think my parting thought would be that when kids have auditory processing issues, it rarely comes in isolation. In fact,
Correct.
I've never seen it come in isolation, that there are other things that are usually involved. From my perspective as a reflex integration practitioner, there are almost always reflexes present. The more significant the auditory processing deficits, particularly with sound sensitivity, the more likely there are to be like sensory reflexes involved, like hands, mouth, and feet, because the entire sensory system is underdeveloped, including auditory processing. And then the last part of that would be that kids often get these layered diagnoses. They have autism, they have ADHD, they have auditory processing disorder, they have sensory processing disorder. But those things are actually different facets of the same issue.
I agree.
That we have a lack of connectivity. We don't have good myelinated pathways between all of the areas of the brain that are involved in those things. And then it manifests slightly differently depending on genetic factors. Things like long-term infection and inflammation are big in this, particularly in the world of ASD. And so the stronger pathways get and the more involved each area of the brain is, the more you will start to see issues in all of these areas start to diminish.
Yes.
Because every person you see in their discipline has criteria on which to diagnose with. So you can get all of these different diagnoses, but what do they look like when you put them together? What are the commonalities?
Exactly.
Right.
Exactly. What's the root? What are the foundations for this? Right. Well, you will be happy to know that one of the closing statements from the recent auditory processing webinar that I did on Saturday was that this is not new to you folks or to me. Gosh, we need to involve people from other fields, don't we? Yes.
Yes, we do. Yes, we do.
Yeah. But I would say that this is a more positive time in the history of working with kiddos with developmental issues because we bring our collective minds together and we listen to each other.
Well, Dr. Judy, I just want to thank you for your time today, for your expertise, for sharing your wisdom with our listeners. It's just been a pleasure to have you as our guest. And thank you for being our second guest on our podcast. I can't think of a more wonderful person.
Thank you so much for inviting me. I really appreciate that. It helps me grow as a professional to keep learning and to be able to bounce some things off on you folks.
we would like to say thank you again to Dr. Judy Belk for joining us on this podcast. Thank you for sharing your kindness with all of us.
You can email us at brainsinmotionpodcast@gmail.com. You can find Mary at her website, brain-works.org, or on Facebook with her Facebook Reflex Integration groups. If you would like that information, please check our show notes. And you can find Angela at angelapt.com or rainbowdragonbooks.com. Thanks for listening.